Next is mitral valve prolapse. So in questions like for mitral valve prolapse, we have a 20-year-old female. We will have a female and she will be young, and complaints of palpitation and dyspnea. On auscultation, there is a mid-systolic clicks heart. This single word means it is a mitral valve prolapse. Okay, which of the following conditions are features of this condition? Okay, so obviously we have here mid-systolic click, and the other MVP word is late systolic murmur, crescendo decrescendo murmur. So obviously this will be the answer, and all of these are conditions seen here written as well. A 30-year-old patient presented, 30-year-old female patient presented. So age is obviously always will be young females. Due to occasional palpitations, mid-exertional shortness of breath, and chest discomfort. Okay, her pressure is normal, heart rate is normal and regular. There is a mid-systolic click, another mid-systolic click. Mid-systolic click means always it is a mitral valve prolapse, and late systolic murmur. On squatting it will be shorter in duration. Okay, so let's talk about all of this. We have the mitral valve prolapse. In mitral valve prolapse, these are the causes. All of these things are causes. Most common is myxomatous degeneration of mitral valve. Next is, in India we have, this is the most common, rheumatic fever due to osteoporosis. Let's talk about this in here. We have mitral valve prolapse. In mitral valve prolapse, that is also known as floppy valve syndrome or Burlow's syndrome, what we have, the chorda tendinis, they are getting lax or loose. We have three stages. They can be lax or lax and loose chorda tendini. They will get lax and loose, and eventually they will get this papillary muscles will have ischemia, and they can eventually rupture at the end. Okay, lax and loose, because of that they can rupture. We have ischemia of the papillary muscle, and eventually also this valve coaptation will be problematic, defective. Is defective. So what are the causes? Let's first see what will be the symptoms and what will happen in this case. Okay, in short, we have these causes. Most common cause is myxomatous degeneration of mitral valve. That is the most worldwide. In India, it is rheumatic fever, most common cause. What is this? Myxomatous degeneration. It is the type 3 collagen arrangement is getting defected. So obviously, it is getting complication is first degree mitral regurgitation. Occurs of broken myofibrils in valve tissue due to myxomatous degeneration. End result is valve bulges up and higher, causing the development of a murmur. So it means that if this is my heart during pressure, it goes, normally it goes this much, now it goes this much, it goes this much, now goes this much. So we can hear here a kind of murmur here. Okay, and complication, obviously if it goes this much, then obviously blood will eventually came out of this and we will have a mitral regurgitation. That's it. Next is connective tissue disorder, that is Marfan syndrome due to chromosome 15. This is previous year question. Defect in the fibrin 1 gene characterized by aracodactyly, that is thumb sign, this thing. Mortality is mostly due to aortic dissection. Next is hyperflexible joints in rubber man syndrome, also known as Ehlers-Danlos syndrome. These are the most flexible persons, kind of seen in circuses. Next is osteogenesis imperfecta. Okay, straight back syndrome. Here the thoracic kyphosis. This is the thorax. This is the back. So this part is getting shorter. Anterior posterior diameter of the chest is lesser. So heart is also getting shortened, sandwiched between thoracic and sternum and rib cage. Here is the heart getting sandwiched. Next is rheumatic fever, astral body, SABE vegetation, dilated cardiomyopathy, and atrioseptal defect. In all of this, excessive stretching of border tendinae which are connected to papillary muscle, they will get prolapsed. The excessive stretching of a rubber band will cause a click, that is the mid-systolic click, and it is the most important line in the questions. Eventually ischemic damage will be seen in the patients and it will cause chest pain. So, and the last cause is also in ostium primum. Ostium secundum, we'll see ostium secundum, that means photo, in MVP, and in ostium primum, that is seen in Down syndrome. Here is no MVP here. Clinical features, obviously young female. Most common symptom is asymptomatic because it takes time to develop. First, most common cause is this ixomatous degeneration. It will just bulges things up, so it will be mostly asymptomatic at first. Eventually, as seen in the questions, patient will have palpitation, chest pain. The chest pain is due to ischemia of the papillary muscle. Palpitation will be seen as premature ventricular contraction, means ventricle আগেই contract করে আছে. So we will see this kind of ECG, that is a normal ECG followed by just directly QR like this. Okay, then again we will have a normal ECG. Next is ventricular tachycardia, PSVT. Atrial fibrillation. Atrial fibrillation, we will have no P wave. We have no P wave, directly QRS, and then this type of twitching instead of P wave, and this difference is irregular. Next is infective endocarditis, transient ischemic attack due to platelet plugs formation that will embolize to brain and cause stroke. So we'll give dual antiplatelet therapy, that is 75 milligram aspirin. And sudden cardiac death, if the caudal rupture occurs, then Any kind of problem will eventually lead to tachyarrhythmia in heart and sudden cardiac death. On auscultation, we will see the ejection click followed by a mid systolic click. So here in questions of mitral valve prolapse. Prolapse will obviously first occurs in females, but here it is heart, so young females. Now we have S1, then S1 means these two valves are getting closed, tricuspid and mitral and tricuspid valve, and these two will get open, that is pulmonary and aortic and pulmonary valve. It will open, so we will have a ejection click. After during this time it is generating power, so this will go up, and here we have the chorda tendinis. Chorda tendinis will get stretched. Because of that stretch, we will eventually see a mid systolic mid systolic click, because it is happening in between the systole and then S2. This is written here. Okay. The sound of this blood leaking into the heart, if this blood is leaking into the heart, it is late systolic crescendo decrescendo murmur. Now eventually after some time it is already getting bulged up, more than normal, more bulged up. Eventually it is already in during systole, blood is already pushing it, and eventually it will come out. When it will come out, it will cause a murmur, and this murmur will be late phase, so it will be increase, blood is going out here as well, but sorry, it is tricuspid, it is mitral valve, here as well blood is going out, but blood is volume is getting lower, from 100 to 70 to 80, 30 to 40, 20, so it will eventually decrease. So it is late systolic crescendo decrescendo murmur. These two words will be in every question of MVP. This we have crescendo decrescendo murmur as well in case of stenosis. In stenosis, aortic stenosis or pulmonary stenosis, aortic or pulmonary stenosis, in any kind of valvular stenosis, what we have, this will, in the very start of the systole, the blood is pushing a lot to go out, and it will produce carotid thrill from the start of the systole. Blood will be pushing, so the after the S1 and S2 we have the murmur start, then decrease, pushing murmur is getting start, blood কমছে ধীরে ধীরে, murmur কমছে, so crescendo, decrescendo. Here we have late systolic, that is written here. Next is this murmur can be heard in axilla, posterior leaflet mitral valve prolapse can be heard into the base of heart, whereas the anterior leaflet will be heard in the axilla, that or in the back. But same is also for mitral regurgitation. In mitral regurgitation also, murmur is heard in the back or axilla, but the murmur is pansystolic. That means it is pansystolic murmur, pansystolic murmur. But here it is in MVP, it is late systolic murmur in axilla or back. Okay. Next is dynamic auscultation. বসলে বা স্কোয়াট করলে ভেনাস রিটার্নটা বেড়ে যায়, so obviously the duration of the murmur is getting short murmur. So this difference, this one is always same, S1 S2, but বসলে শর্ট হয়ে যায় মারমারটা, তাহলে শর্ট মারমার, ইট ইজ দাঁড়ালে তাহলে কী হবে, লং মারমার. সো it is the ejection click, it is the mid systolic click, it is the mid systolic click, it is the murmur, it is the murmur, crescendo, decrescendo, crescendo, decrescendo. Now in this patient we have premature ventricular contraction, T-wave inversion, we have this kind of ECGs, atrial fibrillation, premature ventricular contraction ECG is this. On echocardiogram, transthoracic echocardiography is investigation of choice. Treatment for palpitation, infective endocarditis, we give prophylaxis first degree, beta blocker for palpitation, atrial fibrillation এর জন্য anticoagulants, and in case of mitral regurgitation obviously we'll do repair or replacement of valve, and for TIA low dose aspirin is given to prevent stroke.